Recognizing the member for Cariboo North.
Thank you very much, Madam Speaker. Today, I would like to speak about an issue that affects all of us in British Columbia. Thousands of British Columbians are being left without health care support they need, and this is due to the doctor shortage that we are currently facing in the province. This is something we've seen in the South Island area. We're seeing 3 clinics in the Capital Region shut down this month alone. And this is creating many worries for British Columbians who are now scrambling to find a new family doctor. Langford resident Camille Curry and her family are among those who are now looking for a new family doctor. Camille, her husband, and 2 children have their own complex healthcare needs, and over the past several years, they've had continuous care from a doctor who has been there every step of the way. Unfortunately, their physician is closing her practice, and this leaves Camille and her family scrambling to find a new doctor to no avail. Camille's family is one of many in British Columbia who are left without a family doctor. Almost 900,000 individuals in British Columbia today do not have a family doctor or nurse practitioner. That's 200,000 people without doctors more than in 2017 when the NDP took government. With an 18.2% of the population without a primary health care provider under this government, this is putting additional strain on clinics and creating a backlog of treatment. Our province has already been grappling with the COVID-19 pandemic and the toxic drug supply, but we are seeing another healthcare crisis emerge with more and more British Columbians without access to primary health care. Healthcare workers have done so much for us throughout this pandemic, and it's time we step up and have their backs. Doctors in this province have been experiencing high level of burnout, particularly with long hours and unpaid evening work due to complete paperwork and forms. Just like everything else in the province, the cost of running practices is rising, and these costs are simply unsustainable. The fee-for-service model means that physicians do not make a reasonable wage unless they see 6 to 7 patients an hour. This means doctors are facing a dilemma between taking the necessary time for complex care and ensuring they see as many patients as they can. They're also stretched thin across responsibilities. Dr. Renee Fernandez from the BC Family Doctors says, and I quote, "New to practice family physicians tell us that they want to focus on taking care of patients, but almost all family medicine clinics in the province are run as small businesses," end quote. This means that highly skilled physicians are balancing their time with running the clinic, including tasks related to human resources, IT, and privacy. With the aging population, more doctors, nurses, and other healthcare workers are retiring, which leaves young professionals overworked and feeling burnt out after just a few years on the job. This doctor shortage we are experiencing is deeply consequential and dangerous. Earlier this month, Port McNeill Hospital had to close its doors for 3.5 days because of a temporary physician shortage. This meant that anyone in the Port McNeill area in need of an emergency medical treatment that weekend had to go to Port Hardy, which is 42 kilometers away. This is all too common in British Columbia. Our rural healthcare system is already fragile, but this is exacerbated by the doctor shortage. This challenging has been developing for some time, and it's only going to get worse unless this government takes action. There are many things that we can do to address the doctor shortage. We must train and recruit more doctors and create incentives. Every other province except British Columbia has a re-entry pathway for physicians. We need to look at recruitment options such as perhaps a rural loan forgiveness program. First, of course, we can start by investing in building the promised medical school at SFU's Surrey campus. We haven't seen any updates on this project, but I know many undergraduate students who would like to see more seats in British Columbia in medical schools. And this is a step towards ensuring bright and passionate students in our province can pursue their dreams of becoming a doctor. Beyond simply increasing the number of seats in medical schools, we also need to increase the funding for additional residency spots. This is an urgent and pressing need for today's current graduates, not only the future SFU medical school students. We cannot simply increase the number of medical students. We need to ensure that they have a road to success. Currently, an average of 14 graduates do not receive a residency placement. For every unmatched graduate, 1,875 patients in the province lose out on stable health care, which makes out to be 26,250 patients each year. We cannot afford to leave these doctors behind. This is not only incredibly disheartening to the hardworking medical school graduates, but it is a loss to the entire province when we need more promising practicing doctors now. This is a healthcare crisis, Madam Speaker, we should all be paying attention to. Within this House, we must work together to support our aspiring doctors and provide universal primary health care for all British Columbians, because, Madam Speaker, everyone deserves a family doctor in the province of British Columbia.